Hey there, everyone, and welcome back to Studying with Stephanie. Thanks for coming back. Today, we're going to continue to talk about connective tissue proper, and we're going to dive into fascia. So, fascia is an irregular type of connective tissue, and what that means is that when the fascial layers lay down, they lay down kind of one sheath on top of the other. As connective tissue, fascia is developed from collagen and elastin. And depending on the amount of collagen versus elastin in the fascial tissue, it actually has different purposes and different tensile strengths within the actual tissues themselves. So fascia is this irregular tissue, meaning that it goes multiple different directions throughout the body depending on the function. There's different types of variables between the elastin and the collagen fibers. Now, fascia itself actually intertwines between every single type of our body's tissues under the dermis itself. So from the basement membrane of the dermis down to the periosteum of the bone, meaning that fascia engulfs our nerves, our blood vessels, our muscles, it even engulfs our muscle fascicles. So fascia creates this type of border between all of these different tissues, and that helps to create boundaries and organization within our tissues. Fascia lays within these three different layers as a superficial, deep, and visceral. The visceral layer means that it is covering the organs as well and in between all of the organs. The deep layer is actually those layers that go above the blood vessels. And so fascia is very unique that it has an effect on all of these different tissues. So if that fascia is tight within those deeper layers, it's actually going to compress on those blood vessels, and it can alter capillary refill. It can alter the blood flow throughout your body as well as blood pressure. So it's so important that the fascia itself also gets targeted when we are thinking about treating these patients as a whole. That fascia is very important. Because fascia also gets injured after surgery. If you think about during a surgery, the surgeon is having to open and go through all of these layers of tissue to get to the prominent part that they're trying to work on. So fascia is highly integrated into tissue injury, and it is something that we need to focus on as clinicians, as providers. All right. So like I spoke a little bit about earlier, because fascia differentiates and it engulfs every single type of tissue fiber within our body, it also organizes the tissue. So there's a couple different functions of the fascia. It protects and supports tissues. So if you think about the IT band, it's a highly fascial structure. It supports the lateral femur, protecting it. It also compartmentalizes, like I said, and organizes. So each of the four different quad muscles, they each have their own positioning, but the fascia keeps them separate from each other. So although they all come together in one tendon, the fascia is what divides them and organizes them amongst each other. And when you go in and you do your cadaver labs and you're going into the actual cadavers, you can see those sheets of fascia between all of the tissues, and it is very, very cool to see. And as you break through it, you can see how tensile it is. We talked about how fascia protects and supports, it creates borders, and it organizes the tissue. Fascia also, because of its orientation and the fact that it can have multiple different orientations within just one fascial structure, it also helps provide tensile support and facilitates the direction of flow from the muscle. So it can actually help these muscles out as they're working through by having that tension and kind of storing some of that energy within those tensile components of the fascia. In this same regard, though, the fascia will also limit and prevent excessive motions, because the fascia is very strong in the directions where that tensile force gets pulled, but if the tensile position is coming from a different angle, depending on the actual fascial structures, it could be weak. So fascia is strong, but it's strong dependent on the orientation of the fibers. Fascia also creates some lines of tendon and muscle attachment. So there are some areas where the actual tendon cannot get directly onto the bone, and so fascia and these fascial structures are points of insertion for some of these tendons and these muscles. As well, fascia is semi-permeable, meaning that it allows for some of this distribution of flow so that we're getting that lymphatic drainage and we're getting that movement. So like I said earlier, if the fascia is tight in those deep structures, it's going to inhibit some of those circulatory and lymphatic drainage properties that fascia typically has. Fascia has a very wide range of failure rate because different parts of the fascia have different amounts of elastin and different amounts of collagen. Fascia can actually fail anywhere from 9 to 70% of strain. So that is a huge wide range of fascia being able to stretch versus fascia that is very tensile and will tear. And so we want to keep that in mind of where are those thicker amounts of fascia, where what areas are a little bit more susceptible to faster and easier strains. And like I said, fascia can affect the movement and the muscle activation because it engulfs all of those specific muscles. So if fascia is tight or if those collagen sheets are laying down in an unorganized pattern due to poor healing, it's going to affect the actual activation of the muscle, because instead of the muscle being able to contract nicely, it might not sequence properly because of those fascial restrictions within the muscle. So those, again, are things that we need to pay attention to as therapists. It might not just be the muscle that is getting inhibited, but it might be those fascial structures as well. Fascial healing goes along the same type of sequence as normal connective tissue healing. So we spoke about this in the connective tissue proper video. I went ahead and posted the same slide for you guys in case you didn't watch it, but go back and watch it to get more in-depth understanding of the connective tissue proper healing. And it goes through the same phases. So fascia goes through the inflammatory phase, which is that initial phase where cytokines get released and these kinins get released, and then the fibroblasts come to the area to start the healing process. And then histamine is also there as well, creating this inflammation so that the body can start to heal. And then it goes through the proliferative phase. Again, proliferative, pro-life. We're trying to build new tissue. We're trying to build life into these new structures. So that's when the collagen is laying down, but it's laying down in this unorganized pattern. Again, this is the critical point for us as clinicians to come in and start to stress these structures in a safe manner so that the collagen knows the direction of force and the direction of tension to lay down the new structure, so it's not laying down in an unorganized pattern. And as you can see here on this slide, on the left of the screen, that is a nice, good, healed collagen, good orientation of the fibers. So when that tension comes through, it comes through and that those tissues can slide along each other very nicely, versus the other one where some of those tissues, when their tension, can get ruptured or stretched or not allow for that motion. All right. And so during that proliferative phase, that new scar is also forming. And again, connective tissue scar formation does occur. So this is a different type of structure, a little bit different tissues. And then we go into the maturation phase. This is when everything is now starting to heal towards the stresses that are imposed on it. The strength of those tissues are improving, and those stressors are starting, the collagen fibers are starting to orient to the lines of stress. So that's really important, that maturation phase as well. All right, so as you can see, fascia goes through so many different types of our body. It is an essential component of our musculoskeletal and nervous system, and that is something that we have to consider as clinicians. It is something that is always going to be involved. It's something that you should not forget, because those fascial runs in slings through our body. So different areas. So if you're having a hip issue, it can actually affect the shoulder on the contralateral side because of those fascial slings. So keep in mind that you may not always be searching for the injury at the source, because this fascia can cause issues throughout the whole entire chain. There's the posterior sling, there's diagonal slings through our body, there's the abdominal sling. So the fascia can be a huge contributor to the injuries that we're treating for a lot of our patients, okay? And so it's essential. It helps to organize, compartmentalize, support, move, inhibit, and protect a lot of our organs and the structures in our body. And then it allows for that lymphatic drainage in the circulation. So the fascia, again, has so much to do with our movement system and what we do as physical therapists. It is something that does need to continue to be researched and to be developed as we start to treat different and more holistic, and maybe again are not short-sighted on patients coming in with a hip diagnosis, so I have to just treat the hip, and I might start looking at those fascial slings. So there's a lot more research that needs to be done. When I was trying to research to find some articles and things for this discussion, there's not a lot out there on actual just pure fascia. There's a lot with fascia related to surgeries or IT band syndrome, things of that, plantar fasciitis, but there's not a lot directly on actual fascial slings and the fascia. So a lot more research has to be done, but it is a good foundational aspect for you to know how involved this fascia can be and how important it is to our bodies. So thank you again for watching. I hope that this video helps you understand a little bit more about our tissues and gives you that foundation to build up on your knowledge when you're learning in class. If there is anything I can help you with, or if you have any questions or comments, please drop them down below. Also, subscribe to this video if it helped you out. Share it with your friends. If there's anything particular that you want me to go over, please drop it in the comments below. And if you want one-on-one tutoring, I am here for you. Reach out to me and I will be of service in trying to help you get those A's and really understand and conceptualize these topics. Thanks for coming to Studying with Stephanie. Have a great day. Bye.